Clinical informatics uses IT to deliver healthcare services and to improve the patient's ability to monitor and maintain their own health. Examples of certain IT applications include computerized prescriber order entry, which is known as CPOE. This allows the prescriber to enter the orders directly into their system. Next would be clinical decision support, which is emphasized on my website. These are tools that provide information and recommend certain treatment regimens to prescribers at the point of care. And lastly, electronic medical records, EMRs, which integrate information from the CPOEs as well as clinical decision support and other systems together. Clinical decision support are tools to change the decision-making aspect of the healthcare professional. This can be integrated into many other technologies. For instance, decision support is often built into the CPOE and EMR system, which gives it a broad scope of interest. This feature provides clinicians or patients with more knowledge and regarding clinical information and patient-related information. This is then filtered through the system and presented at appropriate times during the decision process, which is shown through reminders or notifications. This ultimately enhances patient care. Certain clinical decision support interventions include things like drug-drug interactions or duplicate therapies, decision support for formularies, drug allergies, or just basic dosage guidance. Ultimately, clinical decision support tools improve the practitioner's performance in medical decision making. For example, many clinicians and health systems use these alerts for dosing guidance, and this can also be used for smart pumps that verify IV drug rates. Not only does clinical decision support save time, but it also decreases variation. Computerized protocols can reduce variation and increase compliance with certain guidelines, clinical guidelines. In the long run, it's better for patient outcomes. Clinical decision support is definitely evidence-based. This means that alerts and reminders are constructed from the guidelines and protocols or algorithms within that system. And these recommendations help clinicians select certain medications and doses and informs them of certain parameters that they need to focus on. People might argue that this is ultimately practicing cookie cutter medicine or cookbook medicine. I disagree. The more automated the medical world becomes, this eliminates many simple tasks that healthcare professionals deal with and allow more time to handle complex issues for patient care.